Welcome everyone to GW4W's Wine and Tea Wednesdays. We hope everybody has a beverage and we invite you to sit back, relax, and have an inspirational and fun conversation with us today. And please feel free to add in your comments into the chat feature. I am so pleased to be here with my co-host once again, who is also the president of the board for Global Women for Wellbeing and a principal at Lumina Health Partners. So great to have you with us again, Shelley.
Hello.
And we are really excited to have our guest today join us, Dr. Rosemary Morgan. She is the assistant scientist at Johns Hopkins Bloomberg School of Public Health and Nursing. Dr. Morgan leads the Sex and Gender Analysis Core for the NIH-funded Sex and Age Differences in Immunity to Influenza Center. That's quite a mouthful. She is also the co-coordinator for a gender and COVID-19 working group that is working on a CIHR-funded project exploring gendered impacts of COVID-19. Could not be more important right now. They're looking at places like Canada, the UK, China, Hong Kong. In addition, she works as a gender advisor on RADAR, an initiative developing tools to assist in the implementation of measurement approaches for maternal, neonatal, and child health and nutrition programs. And if that wasn't enough, she's also been very involved in some amazing nonprofit organizations that I know are familiar to many of us, including Oxfam and Amnesty International. Welcome, Rosemary. We are so pleased to have you with us.
Well, thank you for having me.
Absolutely. You know, we always are curious about why women go into certain careers, and particularly when it's academia and research. So what was it in your life that got you interested in this? In research in general, but also this connection between women's health and gender equity?
Yeah, well, I think kind of goes back to my childhood, I suppose, and my mom's strong emphasis on education. And I did my undergrad in Canada, that's where I'm originally from, and then went to the United Kingdom to do my graduate degrees. And I didn't have any intentions of doing a PhD, but I guess I'm academically inclined, for lack of a better word, that it fit well with me in the way that I think and work. But that being said, while I'm academically inclined, I also really like work that is applied. And for that reason, I was really drawn to health and health systems, which is a bit more applied than other academic fields. Like public health is very applied as well. And my undergraduate degree is actually in sociology, and then I did health policy and health systems. And I think what really drew me to working in gender and health systems is the need to address root causes of problems. You know, that if we're going to make real change, we need to address structural and systemic issues. And we need to be applied in doing that. And health systems is one way, is a field in what we're trying to address sort of systemic structural issues, which take a very long time to change. And same with gender inequity. You know, that if we want to improve a lot, you know, both in terms of well-being, livelihood, but also health, we need to address inequities, not just gender inequity, racial inequities, other forms. But I think that's, you know, the need to address those sort of root causes really brought me to this space.
Amazing.
Oh, wonderful. What do you think is the most important aspect for leaders, both in the political arena and those in the corporate world, to understand about the connection between healthcare equity and leadership equity?
Yes, that's a good question. So I don't know if people are familiar with sort of health systems models, probably not, but there's some will be, like there's the WHO building blocks health system model, there's other models. And if you look at them, they've got this kind of, the outcomes, equity is always an outcome. Let's improve health equity. But there's very little attention to equity as an input or equity as processes within the system. And so what we're arguing when we're thinking about gender responsive health systems, for example, that how can we expect equitable outcomes if we don't have equitable inputs and equitable processes? And a component of that is health systems leadership, right? So if we think about health systems, about 70 to 75% of health have human resources for health of people who deliver health and social care are women, but only 25%, women only make up 25% of the leadership within health systems. You know, on the whole, we see, depending on what you look at, you're going to see different numbers, but at the aggregate level, 25%. And that is hugely problematic considering how the role that women play in health systems delivery, their role on the ground, looking at what key issues are. So one of the important issues I would say is like, this is a huge inequity just in itself, but then also the need for adequate and diverse representation within leadership is so important. If we want to be able to ensure that we're addressing key issues, if we want to make sure that issues that are relevant for women, for certain marginalized groups, we need representatives from those groups at the table. Because let's face it, we advocate for things that are usually, the humankind advocates for things typically that are important to them, or that they have personal experience in or recognize. And I personally think it's one of the reasons that sex and gender has been ignored for so long. It's because men, to be very honest, were leading and typically for a lot of the cases, and that we've seen this sort of a lack of attention to issues related to sex and gender because they were often conflated with women, which is not entirely accurate.
Correct.
Yeah, sex and gender, everyone, it affects everybody. But so much people thought gender equals women, gender issues, they weren't as prioritized. So I think representation, diversity, and just increasing sort of parity in health and leadership is so important.
Yeah, it's fascinating. I mean, just, you know, from, and I know you and I have had an opportunity to talk earlier too. And, you know, I don't think I still, you know, we say this all the time, and internally, I know you know this and we know this, but it amazes me how many people don't understand the inequities in how health research gets done through a gendered lens. And that still most of these healthcare treatments, you know, we talk about women's health, typically it's breast cancer, it's ovarian cancer, it's, you know, we still don't have enough, I guess, in the broader leadership, you know, when we're talking about people that are developing policy, to understand that we're still basing so much of these health protocols on male physiology. And, you know, and still pushing the envelope in this. I don't, you know, I'd be really interested in just hearing, because I know that you talk to other researchers, and, you know, are you still seeing as many barriers out there in the research world around having gender delineated research when we're talking about different health issues?
Yes, I think we are. You know, the interesting thing about COVID-19 is it's really drawn attention to the role of sex and gender in health, which, you know, is a positive thing in one side. But, you know, for years, sex, like I mentioned before, sex and gender wasn't prioritized, and that included the need for sex disaggregated data, which means that we're reporting data by, you know, the outcomes related to men and women. And even just looking if men and women's physiology are a little bit different. And then you're right that women's health is often related to maternal health, sexual reproductive health, breast cancer. But we know that women have a lot of other health issues, you know, that there's not just women's issues that concern women, right? And what does that mean for where funding goes, where attention goes? So examples I really like to use are related to heart attacks. So women actually experience heart attacks differently than men do, but the way that it's taught to medical professions, the way that we learn about it, we learn about men's symptoms, and women actually experience them differently. And also women as well, when they, because of this, and also biases within sort of healthcare settings, sometimes when they present with these symptoms, that one, they're not recognized or they're not believed. This is even more problematic for women of color, for the you know, the intersection of gender inequity, sexism, and racism. The other example I like to use, which I think is a really stark example, is related to Ambien. So you were right that so many clinical trials, so many drug trials were tested on the male body for so long. The male body was considered the norm and extrapolated to everybody else. right? Which is so problematic in so many ways. And Ambien is a great example of this. So they tested Ambien and they determined that that 10 milligrams or, you know, whatever it is was the dose that adults should get. So men and women were getting this dose. What was happening is that women who took Ambien the night before on that dose were getting in car accidents the next day. And some of them were dying. What this meant is that women's bodies were processing Ambien differently, much slower than men. So when men woke up, it was out of their system, but when women did, it wasn't. So now the recommended dosage for women is 5 milligrams. And just think, this is just one example. Think about all the other examples. There's heart attacks, there's Ambien. Don't get me started on mental health and like autism, misdiagnosis and underdiagnosis. It's just, there's so much gender bias in health and medicine.
Yeah, and I think, you know, a simple explanation, you know, that I share a lot too, is that we know women metabolize alcohol differently. Mm-hmm. I mean, most people know that, just like, even if you don't have the scientific, it doesn't matter, right? We know that when you go to a bar, and if you've ever gone to a bar as a young person or whatever, you know, women do tend to get drunker faster. And it's simply, you know, some of that's just the way we metabolize it in our physiology. And so it just is mind blowing to me, you know, and part of what obviously we all talk about and advocate for is understanding that that happens with any kind of prescription drug. Mm-hmm. Like, you know, but the awareness around that, you know, and I think, you know, the more serious side is things like, you know, chemotherapy treatments for leukemia and some of these things. And, you know, I've heard researchers, I won't mention any names, that, you know, so some wonderful male researchers, brilliant minds. So do you have women in the study? Oh, yeah. So are you breaking out the data by gender? Oh no, we hadn't really thought about that. No. And it's just, you know, so it's this, it's a, because we've been talking, I know you have too, like we've been talking about this for more than 4 years, and you get up and no matter how big, it constantly shocks me that people don't fully absorb that. And I think simplistically it's saying, if your son and daughter go in for treatment to a hospital, does it matter to you if your son gets better treatment than your daughter? Mm-hmm. And even to like take it out of the gender perspective. And again, if we're going to talk about somebody who identifies as non-binary, trans, your physiology is still your physiology. Yeah. And so, you know, how you need to be treated and what it is. I mean, I think it's just, we're still not talking about this enough. And again, it goes back to, well, if you have two leaders that are male and female, both getting treated for the same thing, but one doesn't have true healthcare equity, then there's a direct impact on leadership equity.
I think there's still just a stigma attached to the research and science, and let's not layer the softer issues or think about gender equity and is it different from women or not. There's still a little bit of pushback from science to bring in the softer perspective of gender equity on that, because science is supposed to be just very factual. And the irony is, really, when you put in the lens of gender equity on the science and research, we are actually asking for facts, because it's factual that both physiologies respond differently to healthcare treatments, as Dr. Morgan, you were pointing out. But there within lies a stigma at a systematic level, as you pointed out, that really has to be worked through.
Mm-hmm. Yeah, and it is the awareness. And so curiosity, I know that there's been discussion like at the journal, you know, like the medical journals and things about pushing for more of this. Have you seen any shift?
Yeah, I think so. There's some journals are getting a lot better at requiring you know, researchers, authors to report sexist segregated data or to state. I mean, not all of them are doing it, but I have seen that. I've also seen that with not just journals, but funding organizations. Mm-hmm. I think Canada particularly has been really great at this and making researchers actually take an online course and having sections on their proposals. I think it could get better. I could get a lot better from different funders and different journals, but there is been more of a push, because you're right that it shocks me too to this day that people include women in their, like men and women in their studies, but then don't desegregate the data, right? And then when you don't desegregate the data, to look at differences, it's actually those that are in the majority position is what is representing. So you're losing the voices, or you're losing the experiences of key individuals and key groups. And when you were talking about, in science, it has been difficult. There has been some stigma to try to get gender pushed, because it has been seen as more, I suppose, soft. But, to me, we talk about, I always bring it back to health systems because that's my area, but we talk about health systems as social systems, right? They're not these mechanical bodies that you can pick up in one country and implement in another, because they're made of people, and people, whenever you have people, you have power and power dynamics and power relationships. And this is so important for science, which is why we need anthropologists, sociologists, social scientists. And, gender is very hard to quantify. I work on it with both, more qualitative and quantitative projects, so with numbers and more with stories, but it is very hard to quantify, and we shouldn't be forced to quantify it in some instances, is my opinion. But again, if we want to actually make long-lasting change, like back to those root causes, these are the issues that we need to address.
Yeah. Well, so practically, I mean, moving from research into maybe some real life examples, are there, and again, knowing that you've worked globally, so you've had a real opportunity to get insights into how this works in different cultures. Are there communities that you've seen that have made measurable progress in closing the gender healthcare equity gap?
Well, that's a good question. And to be honest, we still need data. We're still missing a lot of data on that. I mean, think about, even related to COVID, the fact that the amount of sex desegregated data we're missing related to infections and mortality. And there's a great website called Global Health 50/50, which is coming out of a group in the United Kingdom that's really been doing a lot to push this agenda, both analyzing gender equity within organizations, within NGOs, and also within leadership. And they've done a lot with COVID and reporting real-time sex desegregated data. But there's still so much missing, even when we know like the differences, and they're constantly saying we're missing data, we're lacking data, we don't have the whole picture. And even in, I could always draw, like, here's an intervention that was implemented that was effective in changing gender norms. But they're one-off examples. I do think that there are some countries that are, if you look at sort of gender equality indexes, that are better off, the Scandinavian countries, for example, that we point to. But all countries still have a way to go.
Yeah, so are there one or two key issues, like on the flip side, like if you had a magic wand and can say, look, for this data or things that we need to focus on to push this forward, are there one or two key things that you think that are being missed right now that should be included?
Well, I'm a researcher, so I'm always going to go back to the issue of data itself, right? We can't address a problem if we can't see a problem, which is why data is so important. And the way that we collect data, the way that we measure things is so important. And the fact that global health, public health has been so focused on quantifying things means that the issues have been left off the table, things that are more difficult to quantify, like gender, like racial inequality, racism, right? Things like those issues. And I do think that the system needs to change a little bit, and what we value as evidence, what we value as research. I think that we do need different types of data. We need to identify problems in order to address them. We need to also, when it comes to gender, there's sort of different approaches that you can take. I talk about it as instrumentalist versus normative. So instrumentalist approaches are more, if we improve gender equity, we will improve our GDP, our gross domestic product, we will improve our economy. That's a very sort of specific way of viewing it, which is normative, is like, let's improve gender equality because it's the right thing to do. Right. And I am more for the latter, but you'll see that a lot of people are pushing the former because that's how you get the attention of leaders.
Right.
Correct. It's been interesting. gender equity has been top of mind for years, and the progress has been there, maybe slow, maybe not as consistent, but we continue to push the envelope. However, the pandemic has definitely changed the discussion on the gender equity. It almost forces us to look at it through a new lens that we were not looking at before. What would you like to see happen in post-pandemic world, as and when we get to that, that isn't happening now regarding gender equity and women's health?
So that's a great question. And I think that the pandemic is shining light on these inequities that were always there, but also exacerbating them, like you alluded to, right? And it is offering us an opportunity to, we use the phrase build back better. In health systems, we've been talking about building back better. So building health systems, that are, respond to these inequities. So what can we do to ensure that the systems and structures that we have in place post-pandemic, don't, that they address gender inequities, that they're gender responsive, right? Let's face it, that the COVID-19 is impacting gender inequality. And my pessimistic side thinks actually women are likely going to be worse off after this, because countries are not putting feminist pandemic plans, gender responsive plans. There, you have to balance what is referred to as the tyranny of the urgent versus the more long-term. So addressing the most immediate needs. But if we're not addressing the more long-term social, health, economic, security impacts of the pandemic, we are going to, for years to come, we're going to see sort of negative progression, especially in terms of gender equality. So we are in a space right now to be able to change the system, put things in place. Usually it's that we have a window of opportunity here to really make a change, to make sex and gender very important priorities up on decision maker, policy makers, health decision makers agenda, and to make change. But it won't happen if we don't have the advocacy and we don't have the buy-in from leaders.
Correct. It's almost, I often look at it and it's not just top down, it's almost like a top down and bottom up approach. It's kind of that hybrid approach that we need to approach from grassroots level, but at the same time, systematic leadership level as well to bring it down. So yeah, definitely, I think there is work carved out for us collectively go forward as well. And I completely agree with you what you said. If there's anything, I think COVID, the pandemic has really, exacerbated the gaps that exist right now where the system is fractured on that.
Yeah, and there's been some really, like you, I've read numerous articles now because I know the BBC has written about this. It is out there in the United States, other parts of the world. How much of this is going to push gender equity back by decades if we are not louder collectively, all of us that care about this, and saying, we can't just, and again, it's not just raising awareness, it's also saying here are action steps and hopefully getting them out there. And something that's, for such a complex thing, everybody always wants simple answers. And we know that that's never going to really, doesn't work. Yeah. But at the same time, at least putting some hope out there about who are the teams that you're putting together to solve for this. As you reimagine how work is getting done. And again, I know I personally have had conversations with organizations about this. I always bring this up in the conversation. You want to talk about the health and well-being of your workforce, but it's not like a homogenous workforce. Like what's going on? What are the demographics? Not just, different generations, different geographies, all of these things, so that you can intentionally move forward in a way that's going to be more impactful. So there's the pessimistic side of this. And I agree. There's my side that, like you, I read a lot of data and I'm going, oh, we have to get louder. But I also think that if all this shaking up, all this uncertainty is opportunity. If there are going to be organizations out there that are going to embrace this and go, okay, what we were doing in the past really didn't work that well. The past year has really proven that. How do we move forward in a more strategic way?
Yeah, just to say, right now in the United States, with the transition of power that we're having with the presidential election and the Biden and Harris's sort of transition team, where we actually have a really great opportunity to push for that change that we wouldn't have had before. And we've actually, I'm part of a sort of a gender and COVID-19 project that you alluded to, and we just launched this last week on Monday, a brief that is asking for the Biden-Harris COVID response to be gender responsive. And we're building off, we're using the economic recovery as an entry point with this particular brief.
Sure.
Where we're building off, Hawaii has a really great feminist recovery plan, and then Canada has one as well. The UK has one as well. And I'm distracted by your cat. Sorry, I have two myself.
I have just given up.
Let all our pets, kids, everybody talk out loud.
I have given up trying to teach this kitty personal space. It especially does not work on Zoom calls.
I love it. Sorry, I love it. I just had to say I lost my train of thought. But we also have, you can find it on our website, we have our COVID-19, gender and COVID-19 website, and under the resources, we have the brief. But we also have a sign-on sheet for supporters, and we're now about 70 supporters now signed on to this brief. And this is like, we're trying to build, like you said, bring this momentum, have our voices be a little bit louder, and to say, look, we know we have this tyranny of the urgent, right? That we need to get the infection rates down, mortality rate down. But if we don't at the same time think about the long-term implications on gender and gender inequality, we're going to face some huge problems in the future.
Yeah, I also just want to share from another perspective, Cornerstone Capital Partners has put out research, and this is historical research showing how women have contributed to economic recovery, like some really good data. So it builds that business case too, and comes more from the financial perspective. So I think marrying all these pieces together, clearly those of us that follow it and are passionate about this and are trying to drive positive change forward, measurable positive change, which I know we all underscore like about 30 times. It's really exciting to see. And I think, and again, it's not to be political, but I think what you said earlier on, when you look at leadership teams that are truly diverse, gender diverse, faith diverse, ethnic background diverse, every kind of aspect of what that is, we accelerate positive change. Like you just, and that the data's, and again, data, but I mean, we know Harvard Business Review, it's there. And I really hope, moving into 2021 that collectively we're loud enough to push that. So thank you for leading that. Thank you for, making this front and center. And I think, using COVID-19 to then expand on this and understand this bigger health inequity issue that we've got to get solved, is going to help. Will it help us in the next 5 years? We'll see. But it can definitely help the next generation. I mean, those 6 and 7 year old kids, boys and girls, and, that's really what this is for, to make a more sustainable world moving forward. And we are unfortunately at times, always happens. It's just such, I just, from the bottom of our hearts and, the GW4W network, thank you. Thank you for everything that you are doing, your team is doing. And we so believe in more good together. And it's just inspiring to hear you speak and just being able to share with you today. So we're going to ask everybody to raise their glass, and we're going to, toast to a healthier, more inclusive, more sustainable world for all of us.
Hear, hear.
To that.
Wonderful. And we invite you to join us this month for 2 special GW4W heart-to-heart conversations. We wanted to do something inspirational moving into 2021. So we have just 2 amazing groups of female leaders that are going to talk about, first, women leadership and spirituality and how that impacts us and what that brings to the table. And our second piece will be on women leadership and peace building. So we invite you to be part of that conversation, register, add comments in the chat. And if you're not connected to us on GW4W, GW4W.org, we're on LinkedIn and Facebook, and we are looking forward to, despite all this upheaval, a better 2021. So thank you for being with us today, and we look forward to seeing you next week. We will be wrapping up our GW4W series, all 3 seasons that we've done this year. So join us for just some fun. Bring a beverage. We want to toast the holidays for all of us. And even if you're not celebrating a holiday, come celebrate with us anyway. We could all use a little celebration. So thank you, everyone, and we will see you next week.